Hello and welcome everyone. Today we will attempt to try to learn about the Weber's and Rinne's test and how they may be utilized to ascertain whether somebody may be afflicted with hearing loss. Before we move on forward, it may be to our advantage to take a bit of a pause and look a bit of the anatomy and the physiology that's involved in language to be able to hear. Hearing is basically these vibrations that we're going to be traveling through the ear and then propagated into our brain. And perhaps you can think of it as a three-legged relay race. The first leg of the race involves the outer ear. In this first leg of the race, the outer ear will capture the sound waves with this specialized structure of the auricle to allow us to funnel it into this external auditory canal. The external auditory canal will propagate those sound waves into and hit this tympanic membrane, also known as the eardrum. The eardrum will start to vibrate. End of the first leg of the race. Now the second leg of the race involves the middle ear, which is made up of the malleus, the incus, and the stapes, the three auditory ossicles. These three auditory ossicles will pick up the vibrations from the tympanic membrane and be able to allow us to amplify it, make them louder. In the second leg of the race. Then on we go to the third leg of the race. Those vibrations which have been amplified by the malleus, incus, and stapes will then be propagated into the structure called the cochlea, this fluid-filled snail-like structure. This fluid-filled snail-like structure has hair cells inside of it into a specialized area known as the organ of Corti. Once this fluid starts to appreciate the ripples because of the vibrations of the stapes going in and out like that of a piston, the hair cells get pushed up against this specialized membrane called the tectorial membrane, which displaces the hair cells and which then propagates signal down into the vestibulocochlear nerve over here, which is also known as the cranial nerve number 8. When we talk about hearing loss, usually we categorize it in one of two ways. Either it's categorized as conductive hearing loss or sensorineural hearing loss. Conductive hearing loss is basically a mechanical process which can happen anywhere from the pathway from all the events that are happening in the outer ear all the way down into the end of the middle ear. So if there's any issues going on in the outer/middle ear, usually we categorize that as a conductive hearing loss. If we have issues that are arising further inside on the inner ear area, we categorize those hearing loss that are occurring because of situations that are taking place in that area as sensorineural hearing loss. We have two tests that can pick up the hearing loss and to be able to ascertain whether it's conductive or sensorineural. To be able to pick up whether you have conductive hearing loss, we utilize a test called Weber's. And to pick up whether we have sensorineural hearing loss, we utilize a test called Rinne's. Let us now take a moment to appreciate how these tests are done. We'll start with the Weber's test. The Weber's test is done by taking a 512 Hz tuning fork, striking it against the surface, and then placing the base of the tuning fork at the midline of the forehead area, or at the bridge of the nose. This vibrating tuning fork will be placed there, and then we'll ascertain from the patient to see what do they notice. And they may have one of the following responses. They may say, I hear the sound migrating to both sides equally, and that will be a normal response. Another response they may tell us is they hear the sound migrating louder to the left ear. So what that's telling us so far is this. If they say they hear the sound traveling louder, that means there is sound going here, but this louder to the left ear is telling us that they may actually have conducting hearing loss on this side. Now, if they had not said louder, but they had said they hear the sound only traveling to this side, then you got to think of the other side. Why is that the sound not traveling to this side? Then you got to think that on this side, perhaps there's sensorineural hearing loss that's occurring. Okay, so if they say louder, then you're thinking conductive hearing loss on this side. But if they say only to this side, to the left side, then you're thinking on the other side. Why is sound not traveling at all on the other side? It could be sensorineural. We know that, that just doing one test only gets us halfway to our endpoint. So we got to now do the other test to figure out what indeed exactly is the problem in this patient. So we're going to do the Rinne's test. The Rinne's test is done as follows. Rinne's test is testing air conduction versus bone conduction, and we know normally their air conduction lasts much longer than bone conduction. So what happens is we take a 512 hertz tuning fork, we have it vibrate, then we place the base of the tuning fork at the mastoid process, which is that bump just behind the ear, and we keep it there, and we tell the patient to please let us know when you do not hear the sound anymore. Here we are looking at the bone conduction. And eventually they'll tell us after a few seconds that, hey, I don't hear it anymore. And then we're going to take that tuning fork and remove it from the mastoid process and hover it over to the external auditory canal in the outside of the ear, and then ask them, do you hear it now? A normal response would be they would say yes, because air conduction is better than bone conduction. So once you moved it from here to here, they should still be able to hear it in the air, and that's usually a normal response. Also, you interestingly also notice the response with the air conduction being longer than the bone conduction, even if they have sensi-urinal. So I'll put that over here, sensi-urinal. Now, the other response would be that they could tell you that once you've placed it onto the mastoid process and once it stops vibrating, then when you move it over here, they say, I don't hear it anymore. In this case, the bone conduction was better than the air conduction. So if bone conduction is better than the air conduction, then you call that conductive hearing loss. Conductive hearing loss. So um, anytime you notice bone conduction being longer than air conduction, that gives away its conductive hearing loss. Anytime the air conduction is longer than the bone conduction, that could be normal or sensorineural. So that's the way that you look at these tests, and this is the way that these are the simplified version of how you may want to, when you do these tests, this is the way for you to interpret them. Now let us take a moment to practice what we have just learned. Here's patient number one. This is patient number one. This is their left ear, and this is also patient number one, and this is their left ear and right ear. Now I've drawn patient number one twice because we want to do Weber's test on them and Rinne's test on them. Let's run a Weber's test on them. We've taken a 512 hertz tuning fork, struck it, and then placed the base of the tuning fork in the midline of the forehead and asked them, what do you notice? And they are telling us this. They're telling us that they notice the sound traveling louder to their left ear. So here's their left ear, and it's traveling louder to their left ear. Now the key word here is that they're telling us that they're hearing it louder. They're saying that they're hearing it on the other side too, but it's louder on this side. So what that's indicating to us that they may have conductive hearing loss on this side, on their left ear. Now, to confirm that, we can go to the next test, the Rinne's test. Do they actually have conductive hearing loss? Let's figure out. So, conductive hearing loss, we're going to have to confirm it by doing the next test. So, the test, we do it, and this is the Rinne's test. It's done by taking a 512 hertz tuning fork, striking it against surface, and then putting it on the mastoid process and asking them, please let us know when you do not hear the sound. You keep it there until they tell you that they don't hear it. Then once they say they don't hear it, then you move the tuning fork into the ear next to the external auditory canal and ask them, do you hear it now? Do you hear it now in the ear? And this patient is telling us no, they don't hear it. So this is indicating that the bone conduction for the left ear, the bone conduction was greater than ear conduction. Okay, and that scenario here, this setup here confirms, this indicates that we have a conducting hear loss in this both with the Rinne's and Weber's. So this confirms for us that the left side indeed does have a conducting hearing loss, because this is the pattern you would notice with the conducting hearing loss. Now let's go test the other ear too. What's going on with the other ear? The other ear, that we put the mastoid on the mastoid process, the base of the tuning fork, vibrating tuning fork, and they say they can hear it. So bone conduction is there. And then once we move it into the ear, after they told us they don't hear it anymore, and they tell us that they can still indeed hear it. They can still indeed hear it. So on this side, for the right ear, the air conduction was greater than bone conduction, and that is normal. The reason why we said that was normal was because of this air conduction being longer than bone conduction, but also because they told us that a little bit they were still hearing some sound over here, but it wasn't completely gone. So a combination of both Weber's and Rinne's is giving away for us that on their left ear of this patient there's conductive hearing loss, while the right ear is completely normal. Now let's play out another scenario. Now here's patient number two. And we'll make this a wonderful lady, because just to remind us that that she's got left ear and a right ear, but she's wearing earrings, and I'm going to draw. She's wearing a two-loop earrings, and that's reminding us that cranial nerve number 8 is the one that propagates the hearing signal into that nerve and then into her brain. So here's a wonderful lady again, and we'll draw a wonderful lady with the two-loop earrings. This is her left ear, and this is her right ear. So this wonderful lady is now has the Weber's test being performed, and we take a tuning fork that's vibrating 512 hertz. We place it in the midline, and she tells us she only hears sound traveling to her left ear. If she says only, then I'm worried about the other side right now. It's not louder, but it's only going down this way, and I'm worried about the other side now. I'm like, why isn't at least some sound going this way? So I'm thinking in my mind, maybe it's sensory urinal on this side. So I'm thinking this side is normal. So let's go figure out what's going on. Let's do the next test, the Rinne test on her as well. Rinne test, I do it based on the tuning fork at the mastoid, and we say, please let us know when you don't hear the sound. She says she does not hear it after a couple of minutes or so, or seconds. And then we place the tuning fork in the external auditory canal, or near the external auditory canal, to the entrance to the external auditory canal, and we ask her, do you hear it? And she says, yes, I hear it. So here, ear conduction was longer than bone conduction, and this is for the left ear, and that is a normal response. The reason why is because if you looked over here, this is consistent with the normal response, plus with the Weber's test, she was hearing only sound going down this way. So left ear seems to be normal so far. Left ear seems to be normal. All right, now let's go take a look at the right ear. The right ear, we're noticing we take the tuning fork, place it at the mastoid process, the base, which is vibrating, and she says yes, she's able to hear the sound. And then after a little couple of seconds or so, she says she's not able to hear it. Then we moved this into the ear, the tuning fork, and she says she is able to hear it. So in here too, now on the right ear, the ear conduction is better than bone conduction. But in this case, we're not going to call it normal. The reason why is because during our Weber's test, we had noticed that she was not hearing anything going on her right ear. We called it normal over here with this setup, with this pattern, because it also showed us in the Weber's test that there was some sound traveling. That's why we called it normal. But if this pattern is observed and on the Weber's test you don't hear anything on the opposite side, then we categorize this as a sensory urinal. So the person's right ear, this wonderful lady's right ear, actually is experiencing sensory urinal hearing loss. You see, even though they're the same pattern, you have to rely upon the other tests to give you the full story, whether it is indeed normal or perhaps they may be suffering from a sensory urinal. So I hope with these two patients, with these practice patients, we're able to better ascertain how you would interpret the two test results, which then give you clues to the different pathologies which may be afflicting the different parts of the ear. It could be anything from nerve damage, could be tumors inside of the cranial nerves. It could be the auditory osculars being damaged for the conductive hearing loss. Could be infections. Could be fluid buildup for the conductive hearing loss. Whereas you're thinking more inner ear problems for the sensory urinal. Thank you for your time. I hope you found this video useful.